Welcome to the ATP Project. You're with your hosts Nicole and Steve. And today we're talking about what goes in here and comes out here. The whole process, the whole 32 odd feet of digestion.
That's right.
Because we have to know how it works, because then we look at it's like a mechanic has to know how a car works, so he knows that if something goes wrong, he knows what to replace.
That's right.
And, my starter motor stopped working the other day and the car wouldn't start, so that's the starter motor. You know what starts the motor?
Yeah.
Starter motor.
Yeah.
And so we learn, when we went to school, we had to learn about anatomy and physiology, and then we started learning about pathophysiology, the disease of the physiology. So today we're going to talk about the physiology of digestion and the anatomy of digestion and the pathophysiology of digestion and all things surrounding it.
Yes, and not only that, because people might go, God, that sounds boring.
Yeah. Not boring.
Not boring at all. So the reason we're going to talk about that is because we wanted to talk about, we've actually kind of done a little bit of a series on the gut. We've done a few gut podcasts recently, so we thought we'd do this one just to sort of finish it off, because obviously digestion is the beginning of everything. So if you're not digesting well, that can lead to many imbalances and conditions and on to diseases. So, in clinic, I see digestive issues all the time.
All the time.
So we want to look at symptoms around digestive issues. So if you are having issues with your digestion, have a listen to some of the symptoms and some of the causes and then some of the solutions, as we have been recently. We'll put the solutions in the end to help to make sure that you have optimal digestive function. But yes, we're going to go through what the actual process of digestion is first, so people can kind of get their head around the actual process, because then when we talk about things that can go wrong, it's easier to kind of connect the dots when you know how it's supposed to go.
We're going to be talking about from amylase in the mouth to the anus. We're doing the whole thing.
A to S. Stool, I'm just saying stool.
Okay. and it's quite amazing because it's a difficult process. There's a lot to go on here.
There's a lot that goes on,
and there's lots of things that can stop you digesting well. Yeah. So here's the question: where does digestion begin? Like, where does it start?
Well, people may think that, and they might think that they're really smart by saying it starts in the mouth, but it actually doesn't start in the mouth, Steve.
Where does it start?
It starts before you even put anything in your mouth.
Well, where does it start?
So it actually starts with a thought. So if you start to think about food, then your digestive juices start to flow. And then if you see the meal, then you start to salivate. So that's actually the beginning of digestion before you've even put it in your mouth.
So the Simpsons are right again.
Oh, what did the Simpsons say?
You watch The Simpsons, don't you?
I hate The Simpsons.
You're joking.
Sorry to all the Simpsons lovers out there.
Hang on a second. I didn't read the contract.
I'm with two nerds here. So, no, but I have pretty much every time I've ever been past the TV and it's been on, I've known the episodes. I pretty much know all the episodes because when I was a kid, my brother watched it all the time. Yeah. So I know all the episodes.
Well, you remember when Homer's going, donuts.
Yes, and there's a little dome up, clouds popping up.
He starts drooling and salivating and that sort of thing. So that's where digestion starts.
That's where it starts.
And it starts with thought. Yeah. Do you remember the experiment with Pavlov's dogs?
Oh, yeah, for sure. But you tell everyone else so they know.
It's when he rang the bell, the dogs would start salivating because they knew that it was a trained response. So they started salivating because he rang the bell and he would feed them. And after a while, they knew when they were getting fed because the bell was rang and they started salivating and all that sort of stuff. So quite incredible, isn't it?
Yeah.
It just signals digestion. It's like when you smell, for me, bacon. I love bacon. And you just go, oh, my God, I'm hungry all of a sudden. Yeah. Or I wasn't hungry until I smelled.
That's right, exactly. That's because your digestive juices are starting to flow. So, people that maybe get hungry at the same time every day, that could be similar to that Pavlov's, what is it? Pavlov. It's very hard to say.
Oh, it's a great psychology experiment.
The dog guy.
The dog guy.
The dog guy. So that same sort of thing. Your body knows it's pretty much getting fed at the same time every day, so it's starting to get hungry and producing those acids and enzymes to prime itself to start to process the food that's going to come in shortly. Yeah,
and then even if you wanted to stretch, you could say cooking is digesting the food too. It's the start of it too, because you've got to break down the food and that sort of thing.
That's true.
In fact, if I take you back to about 1.7 million years ago, when we were starting to eat more meat and we discovered fire with cooked meat, and we could therefore digest the enzymes and the amino acids out of the meat more if it was pre-cooked.
That's right.
So we started to develop bigger brains back then. We went from early hominids to late hominids. So now we're went from Homo erectus to where we are now, Homo sapiens, and that was largely to do with getting more nutrients out of the food we could catch.
That's right.
Amazing, eh?
Yeah, yeah. So thinking about food is actually the beginning of the process. And then when we put it in our mouth, we're already starting the digestive process. So we have something called amylase that's produced in our saliva, and that helps to begin to break down our carbohydrates. We also produce a little bit of lingual lipase.
Ooh, sublingual lipase? What's lipase for the people that don't know?
Lipase is an enzyme that helps to break down fats.
Right.
So in your mouth, when you put the food in your mouth, you're already starting to digest, break down foods, carbohydrates and fats before you even put it into your stomach. So that's the start of it.
I went to the dentist recently, and they always clean the bottom part of my jaw there because that's where amylase is secreted, and you get a lot of sugar from the carbohydrates you eat there secreted, and that's where a lot of the plaque builds up because of the sugar. And that's the thing, and the bacteria then breaks down the sugar. So you get a lot of plaque build up there where the amylase is secreted. Yeah. So, you know, that's all good, but we don't secrete protease in the mouth.
We don't. No, we don't. So we're going to talk about protein digestion when we get there.
So we're going to sort of take through the hypothetical consumption of nuts, which has proteins, fats and carbohydrates in there, or equivalent. And so in the mouth, we start to break down the carbohydrates, we start to break down the fats. Yeah. Okay, so we masticate. Yeah, we masticate and we chew it all up, and it's got the enzymes, it's got our saliva, and it creates something called a bolus. A bolus of food. Now, that bolus, we swallow it, so it goes down our esophagus. Yep. So we have a sphincter on either end of our esophagus. Which is a round muscular thing that contracts here. Yep. So upper esophageal sphincter and our lower esophageal sphincter. So it goes through our sphincters, and that's important when we talk a bit later about reflux and things like that. It goes through our esophagus, which peristalsis pushes it through our esophagus. And peristalsis, for those who are watching, is like a wave motion. Yeah, it's like the muscle sort of pushes it, kneads it through it's like that tube. Like a hula dancer. Yeah, that too. You know, down the it's good. Yeah, I never really associated the two, but yeah. Oh, I do. Of course, I think of hula dancers whenever I can. That's true, you do. But you could therefore eat upside down, technically. You could eat upside down in your body and it will still be pushed through. So why haven't I tried that? I'm sure a lot of people have. I was going to say I've tried it. Have you? Yeah. Really? Maybe when I was younger and I could stand on my head. God. Yeah, because you just want to see if it actually is going to go down. I remember drinking upside down a beer when I was about a teenager, and it came out of my nose. So that was not good. You know, when we were talking about a different topic before about young boys doing stupid things, and you know, it's one of the stupid things I tried when I was younger. I've tried a few stupid things, but I'm not going to mention them because we don't want to encourage anybody. I'd get emails back in the 90s. There was all sorts of things you used to do. 80s, yeah. I was in the 80s. You were in the 80s, yeah. I graduated in 1986. Did you? High school, yeah. Wow, 1986, I was in primary school. Oh, hang on, was I? No, I wasn't actually. You were what? I wasn't. I was actually in high school. My first year of high school, though. Was it? Yeah, I think it was. My maths is correct. God. Anyway, So if you stand on your head, it will still go down into your stomach. Okay. So, yeah, because of that muscle contraction that pushes it down. Well, that's why the stomach acid doesn't roll out when you're upside down. That's right. Yeah. Well, that's your sphincter as well. Sort of keeps everything in your stomach theoretically, but in some people it doesn't. So then it goes down into your stomach. So then all the digestive process really starts. Yeah, it really cool starts. So in our stomach we've got a pit of acid, hydrochloric acid. Yeah. Yeah. Okay, so what does that do, and why have we got acid in our stomach? Well, acid we need to obviously begin the breakdown of our foods. It's also antimicrobial. Yes, as well. That's very important. Very important. So we have little cells in the lining of our stomach called parietal cells, and they secrete hydrochloric acid. So we don't have hydrochloric acid just sitting in our gut all the time when we're not eating. Otherwise, we'd be burning holes through our lining of our gut all the time. So with the digestive process starting, you know, I said we get those juices and acids and enzymes all flowing. That's the hydrochloric acid is starting to be produced in the gut. So when the food goes down there, the hydrochloric acid starts to mix all in with the food and starts to break it down, kills off any bacteria and parasites. And we're always taking in, you know, things in our food that we maybe we shouldn't have go all the way through. So the hydrochloric acid will help to kill that off. Yeah. So we produce hydrochloric acid, but this is where we begin the process of breaking down our proteins. The hydrochloric acid, just on the hydrochloric acid, so they put it in context. it's the same acid that you put in your pool to balance your pool pH.
Yeah.
So hydrochloric acid. That's why, if you ever seen on the bottles, it might say, if you drink this poison, hydrochloric acid, don't induce vomiting. Because once it's in the stomach, it's relatively safe.
Yeah.
If you induce vomiting to get rid of that out of your stomach, it can burn the esophagus and the windpipe and everything on the way up.
Yeah.
So, that's why it's a poison that you do not induce vomiting. That or detergents, because you can get foaming and that can cause you to sort of asphyxiate. So you die that way.
Yeah.
So, it's very important with pool acid that if...
we hope no one's going to be drinking pool acid, but and keep it away from your children.
Of course. We used to tip it in the pools to bring the pH down a bit.
Yeah, okay. So I never had a pool.
Didn't you?
No.
I owned one
we weren't
once.
that lucky.
It's a pain in the arse.
Oh, we had an above ground pool. The plastic ones that stand on the side and it bows and then the water falls. Yeah, we had one of those. Thanks, Mum. But anyway, yeah. So protein. So we also produce something called pepsinogen from a cell in our gut of our lining, and the pepsinogen then mixes with the hydrochloric acid, and that becomes pepsin, and pepsin is what breaks down our proteins. So that's also important when we talk about malabsorption and low stomach acid when we get to that point.
Get to that.
So the pepsin is mixing with the hydrochloric acid, breaking everything down, and we also we have cells in the lining of our gut that produce mucus. So the mucus is then produced, and that helps to line the stomachs because the acids and the enzymes and all that sort of thing are, all churning around in there, and that protects the stomach from actually the acids burning through it.
And you mentioned churning around there because the stomach is a big muscular thing around it, so it does actually physically move to help with digestion as well.
Every 20 seconds it will move it around. So, and that helps to sort of, churn it all up.
Yeah.
And so then that will break it all down into smaller pieces, and then it becomes something called, now I say chyme. I say chyme.
Do you?
Because and some people say chyme, some people say chyme. I think chyme's more the American one, but that's why I always kind of grew up with it. So I don't know. Don't shoot me, anyone out there. She's saying
if you're interested, just chime in with something.
I'm sure it's probably chyme. I'm sure it's probably that was a bad one.
Joke's terrible.
Very bad one.
God, a quick drink. Shut up.
So it becomes chyme or chyme, however you want to say it.
All right.
And then it sits in the stomach until it's at the point where it will then move through into your small intestine. But it won't move into your small intestine until it's in a small enough and sort of a liquefied enough state to actually go in there. So some people that say, feel like the food is just sitting in my stomach, there's a reason for that. We will talk about that. So then it moves into the small intestine, and the small intestine is amazing. That's where all the good stuff happens.
So at the duodenum? The duodenum.
Yep.
The jejunum and the ileum.
Yeah, so 3 parts to the small intestine. So all the good stuff happens here, but a lot of bad stuff can happen here too. Things go a bit sideways, which we're going to talk about. So the first part, which is the duodenum, that is where we start to... your pancreas will excrete some digestive enzymes, some more lipase, amylase, and your gallbladder will start to squirt out some bile, which does a lot more things than just breaking down fats.
Cool. We did a podcast years ago on bile.
Yeah,
Remarkable.
not so vile bile. How's that? No. I don't remember the name of it.
Is that the name of it?
That was the name of it. How's that? That just came out of the back of my brain.
I didn't know we called it that.
Yeah, so not so vile bile it was called. So if you want to go back and listen to that. But bile, it has so many functions in the body, and very, very common to have low bile acid production, low bile flow, sluggish bile, all that sort of thing. And we're going to talk about what can happen if you don't produce bile very well or you don't have good bile flow.
Right,
so that actually gets in there. It helps to emulsify our fats.
Yes. So
not only does it do that, it is antimicrobial as well. So anything that's coming through the stomach into the small intestine that maybe didn't get sort of neutralised by the stomach acid, the bile will then come and kill that off, because we don't want pathogens and things getting into the small intestine. We have less bacteria in our small intestine than in our large intestine, a lot less. So small intestine is where we do all our absorption of our nutrients and things like that. So we have little finger-like projections on the lining of our small intestine called villi. And on those villi we have even more microscopic villi. So the reason for that is it increases the surface area for maximum absorption of our nutrients. So we want to have good villi. People with celiac disease, that's what can damage their villi if they're having gluten. It flattens it out, and that's why they can become have a lot of malnourishment, that type of thing. So there's the villi, and then that microvilli, and then that's what's called the brush border. And the brush border then releases more enzymes that break down those protein bonds. So along with the pancreatic enzymes. So we do a lot of that sort of breaking down and absorption in that first part of our small intestine. So.
And it's remarkable. Think about the amount of. Let's have your big, 12-ounce steak or 300-gram steak. For those people like me who metric, I'm both because I'm old.
Okay.
But let's say a big piece of steak. Virtually all of that is absorbed in the small intestine.
Yeah.
And you could eat that if you wanted to 3 times a day, and it'll all be absorbed.
Yep.
That big piece of hard,
crazy,
tough steak you can bang against the table.
Yeah.
And you just masticate it and. It's all
away it goes.
Away it goes.
If your digestion's working optimally.
Yes. We were getting into the disease stuff later.
We're getting to the good stuff, everyone. Just hang in there. So then it goes through into the second part of the small intestine, which is the jejunum.
Yeah.
Jejunum. So that's when you have just more absorption, more of the macronutrients are absorbed in there, and then it moves into the ileum, which is the last part. There's not as much absorption that happens in that last part. So pretty much by the time it gets to the ileum at the end, then we've pretty much absorbed most of our macronutrients, micronutrients, that type of thing. So then it will move through the ileocecal valve, which is important because we'll talk about that later too.
Oh, yeah.
Into the large intestine.
Yeah, it's weird because, in my brain before I started studying this, I thought it was large then small.
Well, you would think so, wouldn't you?
It just does. And I still think about that every day. I don't know why I thought that.
Yeah.
But I just didn't know any better. And I thought, stomach's very large. You can put 4 to 6 litres in a stomach if you wanted to.
Yeah.
And then it gets smaller and then smaller again. But it's not. It goes large, really small, then large again.
Yeah. And the small intestine's much, much longer than the large intestine.
About 30 odd feet, isn't it?
Yeah.
About 9 metres.
Yeah, very long.
Amazing, isn't it?
So, it needs all that to get the absorption of everything that we need. So it moves in the large intestine. Large intestine is where the bulk of our microbiome live.
Yep.
So we have obviously the 3 parts. So we have the ascending colon, the transverse colon, and the descending colon. So all the way through there, what's left of the chyme will go through, and then that's when anything else that needs to be absorbed will be absorbed. So a lot of electrolytes and things like that can be absorbed.
And water.
Water's reabsorbed. And then all our bacteria get in and they start breaking down what's left, which is a lot of the fibres and things like that. And then they convert those to short-chain fatty acids, and that is what helps to keep our colonocytes nice and healthy. So the cells of our colon really healthy. And then obviously looking after our beneficial bacteria, they produce their own vitamins and they're anti-inflammatory and all those different things that we've talked about in previous podcasts.
Yep, it's quite amazing because we were talking about we were talking about doing a Mythbusters talk before. And one of the myths is that acid causes cancer. You heard that?
I haven't heard that.
It's an acid thing.
I've heard it's stomach cancer, stomach ulcers.
Yeah. But it's sort of like it just shows you that the fibres are broken down into short-chain fatty acids and they're anti-carcinogenic and very good for your colon.
Yeah, definitely.
But, you Google acid and cancer and you'll see some kook on YouTube talking about got to deacidify the body. And it's like, really?
Well, there's different parts of our body that are more acid and there's different parts that are more alkaline. So obviously our stomach is very acidic.
Very.
Small intestine's much more alkaline.
Yep.
Our blood needs to be alkaline.
Yep, 7.4.
So, yeah, exactly. So it differs. So, I always laugh about people that drink alkaline water and they put it in an acidic environment and expect it's going to, I don't know what the
It's like drinking antacid.
Yeah, that's right.
To me, because I'm a chemist, so I'm very left brain on this thing. And acid is a specific high proton. Okay, it's hydrogen, H plus ions or protons, whatever you want to call them. They are acid and they're good and they're bad. They're good in your stomach. And you can stop them with drugs, but we'll get to the drugs and that sort of thing. We're getting into the large intestine. So, we go into the descending colon, then we go to the rectum,
and
then it all just forms.
Rectum, and then basically the stool will form and it will sit there until you're ready to get rid of it. So it doesn't just, there's a reason for that because otherwise we'll be walking around dropping bombs everywhere. So your body needs to hang on to it until an appropriate time. So so that will sit there until you then excrete it.
I know.
And we can even talk about even positioning when you're excreting and things like that.
Yeah.
It's important. Squatty potties and things, we can get into that. That's kind of cool too.
I've never, and I go camping a lot.
Yeah.
So this is not new to me, the squatty potty, but I struggle with it.
Do you?
Yeah.
Oh.
Because I'm so inflexible. I've told you about my AS and that.
Yeah.
Just squatting deep like that.
Yeah.
It's like I'm just
hard
shit at
work.
it. Real bad at it.
Oh, that was a...
Yeah, I know. It's a bit of a play on words.
Yeah, play on words.
Why should I use a squatty potty? What's the anatomical benefits of that?
Okay, so naturally we are designed to have more full evacuation when we're in a squatting position.
Okay.
So if you look at babies or toddlers, so running around, if a toddler will squat down to poop,
Yeah.
even they've got a nappy on, they'll actually squat to poop because that's the naturally how we've sort of designed, and then obviously they're trained to use a toilet, so then we sit.
Yeah.
So there's something called the puborectalis muscle, and actually pulls that rectum and it sort of pinches it off. So when we're standing, obviously it's pulled off. So obviously, like I was saying earlier, you're not going to start pooping all over the place.
Thank goodness. It's been in this podcast room for an hour and a half. Yep.
So when you sit down, that muscle will relax, but it won't fully relax. So that rectum is still pinched off somewhat.
Okay.
But if you're in the squatting position, it fully relaxes and it opens up the rectum and it allows you to get full evacuation. So a squatty potty basically just lifts your knees up into a high position.
Yeah, okay.
So, and you can use a stool, you can use anything, and you just put your feet on it. So it just brings you more into that squat position. So if you're having trouble with full evacuation, give the squatty potty a go.
I'll give it a go. I'll send you a video.
Oh, you know what? I feel like maybe just tell me.
Okay,
I don't think I need to
I
see
will.
it. So that's one thing. People look at your squatting position. So Asians will actually, have you seen Asians will actually stand on a toilet and squat?
Yes.
They get in trouble for it in this country. They're not allowed to do it, but they squat.
Right, I'll
they
give it a
know
try.
what they're doing, so there you go. So give that a go.
I will.
Okay.
God.
So that's just a bit of a summary of the actual process from the mouth to the anus, just so everyone can start to get their head around what's supposed to happen, and then we can get into the good stuff.
That's good stuff.
The interesting stuff of what can actually go wrong. And what is very commonly goes wrong with a lot of people. And a lot of people that think that things that they're having happen to them are normal when they're actually not. It's an indication that there is something going on in the digestive function.
It's incredible, isn't it? I mean, you start at the mouth if you want to start there. I mean, one of the most common diseases in the Western world is dental caries.
Yeah, that's
Everyone's got a filling at least or some degree of it.
I
Really?
don't have any feelings. No.
Are you shiting me?
I'm not shiting you. I don't have any
Really?
feelings.
Oh, that's right.
And I will premise that I did have a filling and it fell out with half my tooth.
Oh, okay. So,
but that's the only filling in my expansive years that I've been around.
I've had a root canal
Oh no!
when I was about 30.
Or we could do a whole podcast on root canals and how they're connected to autoimmune conditions and
Thanks,
things.
yeah, great. No, I got it when I was about 30. I was working.
Did you?
Tell you. I've got a weird
Have
shape.
you had it taken out?
No, it's still it's still there. It's just it's been there for decades.
That's a whole other podcast. But there's and this isn't the cause of autoimmune conditions, but it can actually be in some cases. Can be because the bacteria if they don't clean it out properly, the bacteria then stays in there and it can go into the bone and then it travels through the body and it can be a whole nother. So if anyone's having a lot of issues, autoimmunity, things like that, and they've had a root canal, have a look at that. Could be a...
Can I tell you a funny story with that? Is root canals are awful things and I wouldn't recommend them anyway. But what I did was, and back in the day, you could get it all done in one day, which now they actually inject the tooth with antimicrobials and leave it there for 2 weeks.
Do they?
Yeah.
Oh, wow. I've even still got my wisdom teeth.
You've still got your wisdom teeth?
I do.
So why are you so smart?
No,
I had mine pulled out when I was 18.
No, mine never came down. Yeah.
Mine were growing like, when it's supposed to be growing like that, they're growing like, looked awful.
Mine and my mum. My mum's never came down either. So.
Really?
Yeah, no, they're there though. They used to say to me, I'd get the old, if you don't get them out straight away within the next few weeks, they're impacted, it's going to travel to your brain and cause brain infection. That would have been 15 years ago that they said that. So I think I'm all right.
Yeah, I think you're safe.
Yeah, but anyway. But yes, so what can go wrong? So what are some of the symptoms? So now let's talk about what can disrupt our digestive function to begin with. So low stomach acid.
Yeah, that's a good one, because low stomach acid can be caused by doctors.
By doctors?
Yeah.
Can it?
Well, imagine if you prescribe PPIs.
Oh, that's true. Yes, they can create low stomach acid by some of their actions.
Well, they're a very common prescription of PPIs, which are proton pump inhibitors, and a proton is an acid. It stops acid being produced, but they've got some horrendous side effects.
Yeah, we can talk a little bit about PPIs.
And there's some of them that are over the counter now, PPIs.
Yeah, I remember when back years ago, after I finished competing and that sort of thing, and I was getting severe heartburn. I was downing a bottle of Gaviscon a day.
Really?
Yeah, so you can just go buy that in the supermarket.
Yeah, you
antacid type medications.
It's the pink stuff.
Yeah, the pink stuff. It tasted great.
Did you?
Yeah, yeah.
I've never taken an antacid.
Haven't you?
Never in my life.
Wow.
I'm not joking. I can't even remember taking some quickies.
Wow.
Which is old day stuff.
Yeah, that is old day stuff.
I remember seeing them there, and I've never actually tried some.
Well, I mean, I take natural ones now if I need them, but we need to. There's a reason why you have heartburn. There's a reason for it. Low stomach acid is more times it's low stomach acid. People think it's high stomach acid. I'm producing too much acid, therefore I'm getting the pain. Most of the time it's low stomach acid that's doing it, and it's what's happening is you're obviously not producing enough acid in your gut, so when you eat, as we said, goes down into the gut to be starting the digestive process. There's not enough acid in there, so the food doesn't really break down very well, and it can sit there. And that's why you can get that feeling, I feel really like just that fullness, and my food's just sitting in my stomach. And what can happen is it starts to bubble, and it sits there long enough and starts to ferment where it shouldn't be fermenting. And it can actually, that intra-abdominal pressure actually pushes it back up into through the sphincter back up into your esophagus, and so you're getting that acid, but it's actually because you've got low stomach acid. There is some cases where people have high stomach acid. As I said, it's a lot less, but it can be the case. I can give you a really cool at-home tip about how to check if your stomach acid is low or high.
I want to know.
Later.
What is it?
We'll talk about that one later. We'll leave that one.
Shit.
In our solutions section.
Do I have to wait till the end of this podcast?
To the end of the podcast.
So it's commonly called GERD. For those people, gastroesophageal.
GERD or GORD, depends which country you're from. Yeah. GORD in Australia.
Is it?
Because we spell it O-E, esophageal, not E. So in America it's GORD because they spell it
esophageal with an E, yeah.
They spell, so we spell it with an O. So in Australia it's GORD.
So I've just been quoting all the medical terms from America.
Oh, the American terms.
GERD.
Yeah, GERD and GORD, same thing though.
GORD, okay.
Yeah.
There you go.
Yeah.
So it's like estrogen.
Yeah. So we spell estrogen with an O as well.
Yeah.
Yeah, and on my clinic platform it doesn't recognise it, so it always does that red underline.
Oh,
You spelled it wrong. I'm like, no, I haven't.
Stupid Americans.
So we love Americans. Not stupid at all. We could probably have a lot of American people listening.
Yeah, I just wish they'd spell things correctly.
They do need to spell things
How do they spell colour with C-O-L-O-R?
well, actually, I must have an American platform because it doesn't let me spell colour with a U. It doesn't let me do any Australian terms, which is frustrating. So I just have red lines all through my notes.
We speak the King's English.
The King's English,
I was going to say the Queen's English
anymore.
So,
I know, the King's English.
Yeah, that's going to be weird, isn't it?
Yeah, it is.
Right,
so low
else
stomach acid is something that can cause digestive issues.
Sure.
Or be a cause of and cause.
Yep.
Low enzyme production and poor bile flow. Very, very common.
Very common.
We're going to talk about the reasons why. Or should we talk about the reasons why now?
I like the reasons.
All right, so let's talk about the reasons why you might have low stomach acid and enzyme production. Stress is a big one. It's biggest.
Everybody's sort of got it, haven't they? Stress.
Everyone's got stress. Yeah,
and it's really, I see it a lot. And when I was in clinic, and not got the extensive experience you have, but every single person was stressed about something that was very different to everyone. And I learnt quickly not to judge people that was, because you think, I wouldn't stress about that. But people, it's real stress to them.
Yeah, everybody's stress is relative to what's going on in their lives. So you can never say to one person, "Oh, what are you worried about?" Because it's relative to their thing. So you can't. Yeah, it is what it is. So stress is a big one. So and we may as well talk about that now. People are stressed, and then they sit down and they eat a meal. So remember we said, the digestive process starts when you start thinking about food, that sort of thing. Most people these days, they eat on the run. They eat when they've got a chance. Like I'm racing to work, I'll eat it in the car, or I've only got a short amount of time for lunch, so I'll just quickly eat it while I'm sitting doing work. It's not even thinking about the relaxing and thinking about the food. So their body hasn't had time to start to produce those acids and enzyme, the saliva, all of that sort of thing. And they are needed to activate bile and pancreatic enzyme function as well. So you need that whole process to work down the line. So if they're highly stressed, they're not going to produce those acids and enzymes, and that can be a cause, or that can definitely impact your digestive process.
Well, also acute stresses that happen, like, you get home from work and you're stressed.
Yeah.
And then you're supposed to eat dinner, then a big meal.
Yeah.
And you're stressed.
Yeah.
It's like,
and we're going to talk about how you can
or the
work
kids are
around
giving
that.
you, a hard time at home or something.
Yeah. Oh, there's all sorts
Not
of
for me.
Not for me. Sorry. I don't even have a puppy to worry about yet. But I will. Yes, but no, we don't have kids stress. But yeah, that's definitely a factor. The kids yelling and screaming, and I want my dinner, and so you've got to hurry up and get their dinner. And
I don't know
like
how
that.
mums do it. I'm in awe of how they can cope with it. It's like,
I don't know how they do it and work full time and look
Yeah.
after the kids and look after the husband and look after their animals. I'm like, no, I couldn't do it.
God.
I admire them. Yeah.
It's just extraordinary what they do.
Yeah, they do. So, like acid and enzyme production, poor bile production and flow, and we're going to talk a bit about that as well. What are some of the other things? Let me put my chronic stress we talked about. Eating on the run.
Eating on the run, yeah.
Here's one that I reckon just about everybody would do and not think about. They don't chew their food properly.
Yeah.
So common. Ideally, you want to chew your food up to 40 times before you swallow it. I mean, obviously, who's going to do that? Like, realistically, no one will.
Be a chronic masturbator.
Yeah, maybe masticator.
That's right. I've got to be careful how you say that.
Yeah, but most people will just, those people that just like woof down their food before you even turn around and it's gone.
Yeah.
So if you're not chewing your food, like we said in the beginning, you're not activating you're not getting that amylase and lipase production in the mouth to begin that digestive process. So it's going down there. So already you're on the back foot for when it gets in the stomach.
Yeah.
And that's so common that people don't chew their food well anymore. So
It's disgraceful.
and here's another one that goes with these go hand in hand. So they don't chew their food, but then they chase it with some water just to get it down because they haven't chewed it properly. So they're like, I'm going to get it down with some water. So then the water will dilute any acids that you are producing if you are producing many anyway because you're rushing. So then you've got even less acid and less acid concentration. So just drinking water with your meal and not chewing it properly can be enough to start to throw things off. And then if that becomes chronic over a long period of time, you can start to see a lot of imbalances as a result of that, just from those two things.
Well, I'll go one worse for you. What if you drink it with, and a lot of people do, soft drink?
Well, you're just adding more sugar into it, aren't you?
And if you're drinking soft drink, it simply slips past the tongue, so no amylase goes in there.
No.
So you get a big bolus of sugar in the stomach.
Yeah.
The body's not really adapted to, and people drink Coke every day sometimes.
Yeah,
I don't know how it all. Like I know how the digestive things. I just don't know how they get away with that for so many years.
I don't know how people still drink Coke and stuff, but yes, I mean, I'm sure most of our audience don't because they're also health conscious.
No, they're all brilliant. Our audiences are brilliant, smart, intelligent,
they
and
are
good-looking.
very smart. That's all of those things. They are. They really are. So another one is, so we can talk about medications now. So let's go into that a little bit more. So proton pump inhibitors is probably the biggest one, like you said. So the acid blocking medication, really common, one of the most commonly prescribed medications because everyone has acid. And everyone has acid. Why? Because we're all stressed on the run. And so we're not doing the things that I said that we said at the start that you should do. So the doctor goes, here, just take a PPI, some Nexium or something like that. So that actually blocks any acid, and bear in mind that you're probably not producing a lot anyway. It's more that push that abdominal.
But it gets worse because there's 24-hour Nexiums now.
Yes, there is 24-hour Nexiums. I know. So yeah, it's not good. So that basically blocks the production of HCl from your parietal cells in your gut. So it shuts that down. The worst thing about PPIs is you can have a rebound effect from PPIs. So have you heard people say, every time I try to come off them, I just get my acid gets worse. So they just get back on them and it's just a continual cycle. Because what happens when you're on a PPI is that parietal cells actually enlarge because they're like, okay, we're not
full of acid.
Yeah, when there's not enough acid produced, what do? So they're enlarging, and as soon as you stop taking the PPI, because my acid's calmed down, they just explode with all this hydrochloric acid. So then you get more. Then you do get a high acid load for some amount of time. So then you go back on the PPI.
God. So
and it's just a continual cycle. So, and PPI use long term. I think we've spoken about it in the past. You can start to have many nutrient deficiencies, all that sort of thing, because you're not digesting your food very well, and therefore you've got no absorption.
A big study in Asia showed it increased gastric cancer risk.
Yeah, it can. Yeah. So,
nuts, eh?
Yeah, it is nuts. So you don't have that antimicrobial effect because you don't have the acid. So then you get, you can get some parasitic infections and things like that as well. So PPIs, very bad long term. Short term, if you need them, but look at why you have the heartburn. Don't just take it and think everything's great, because it's just going to get worse again.
Yeah.
NSAIDs, so non-steroidal anti-inflammatory drugs.
Yeah, I was on them like lollies when I was with my arthritis. And people take them for years too.
Yeah, they do, yeah. Well, doctors prescribe low-dose aspirin every day for people with heart issues, which we've just done a podcast on cholesterol and things like that.
Yeah, absolutely.
But, yes, can cause ulceration to the gut.
Yeah, it knocks out COX-1, which is a healing agent in the gut. So if it knocks out COX-1, you get no healing agent, so you get ulceration to the gut. Terrible stuff long term.
It is.
Has other side effects, nephrotoxic, very bad for the kidneys.
Yeah, really bad.
Really bad. And the other one you mentioned here is antibiotics.
Yeah, we all know how bad antibiotics can be.
And it can get scary. Like most people think antibiotics, you take it for a week or two for your infection. There's, like if you've got appropriate bacterium acne, or acne vulgaris, normal acne, you can go on, tetracycline for 6 months.
Yeah.
I mean, how scary is that?
I know personally and also professionally some people who have significant either inflammatory bowel diseases or, say, diverticulitis and things like that, and every time they have a flare, the doctor puts them on antibiotics.
Yeah.
So they might do 2-3 rounds of antibiotics to get the flare under control. They might have flares 5-6 times a year. That's 12 rounds. That's like every other month they're taking antibiotics. It's just decimating their microbiome. So,
I've been fortunate. I haven't had antibiotics for decades.
No, neither.
I'm really reluctant, and I know if you're prescribed by a doctor, take them, of course. This is what we say. But certainly...
For a bacterial infection, let me premise.
Bacterial infection,
Not a viral infection,
No.
people. So people go to the doctor, they get a virus, and they say, I want antibiotics, and the doctors go, yeah, take them. They're not going to do a thing.
No.
All they're going to do is knock out your microbiome, and you're going to have a bounce-back effect. You'll probably end up with fungal overgrowth, possibly end up with a fungal overgrowth. So you'll have a virus and a fungal overgrowth, and the antibiotics have done nothing.
And most colds of flus are viruses.
Viral.
Well, flu is the influenza virus. There's A, B and C.
Yeah.
A being a real bad one that's going around now.
Yeah.
And if you've got COVID, well, COVID is the V stands for virus.
Yes.
And if you've got, just a normal cold, it's usually the Rana virus.
Yeah. So just be mindful of what if you go to the doctor and he says, here, take some antibiotics, say, is this bacterial or is this viral? Just maybe sort of premise that. But if you have a bacterial infection and it's severe, then obviously antibiotics will save your life. So they have their purpose, definitely, and their place. Here's one that people might not think about.
Oh, yeah.
Surgical adhesions.
Oh, yeah. So that's when you've had an operation and it didn't heal right and you got adhesions, which these things sticking to each other which shouldn't.
Exactly. So part of your intestines can maybe stick together with that adhesion. So things like people that have had a tummy tuck, and that's a very big scar, sometimes from hip to hip. They can get that. If you've had your appendix out or your gallbladder out or you've had anything. Yeah, endometriosis, those types of things.
Hysterectomy.
Yeah, hysterectomy. Any sort of abdominal surgery. Generally, it's not uncommon to see digestive issues develop sort of in that 12 months after you've had the surgery. So if you wonder, you've got all these digestive issues and you just really don't know where it's coming from, you've tried everything and you have had abdominal surgery, maybe have a look at that.
I've got one more for you.
Yes.
Semaglutide, like if you have an injection for weight loss. Now, we really shouldn't be, it's so common though. This is so absolutely common. Yeah. I've got 2 people in my close family that are on it.
I've seen quite a few
people. And a third
that
I was talking to was going to go on it.
Yeah, we're talking about, can we allowed to say the name of it?
The what?
The drugs, just so people know what we're talking about.
Oh, semaglutide. Can we say the name of the drug? Yeah, it's Ozempic.
Yeah,
I just kept the generic thing. But it's, and the side effect of that, and you can list it on it is because it's a GLP-1 agonist. So in other words, GLP-1 slows down your digestion.
Yes.
So the theory is that if you slow down digestion, you're not going to feel like eating, therefore you're going to lose weight.
Yeah.
Or if you've got diabetes, it slows down digestion, so it slows the release of sugars, helps diabetes. So that's the mechanism. So the mechanism is the effect. It causes the indigestion.
Yeah.
So it's sort of like that's not a side effect, that's the effect. So it's not like it will cause side effects. And I mean, I'm calling this out to anyone who's just trying to lose a few pounds. Shit, you really need an expensive injection to lose a few. How about go for a walk?
Not worth it.
How about eat healthier?
Yeah, it's not worth it for your health in the long run. But each their own. Everyone can make their own decisions of what they want to do. I think it's just good having the full knowledge of the good and the bad. the negatives and the positives of whatever you're doing, so then you can make an educated guess on educated decision on whether it's right for you or not.
Like, I don't think cancer is worth it because it's a listed side effect of getting thyroid cancer.
No, I don't think so. There's other ways to lose weight, but
geez.
yes.
Sorry, get off my soapbox now.
So surgical adhesions, gastric bands as well.
Yeah.
Also because, sometimes people will still try and push it, get it through into the stomach, which has been pinched off somewhat, so you'll get that pushback. And I have seen clients that have had a band that's actually fused to their tissues started to grow around the band.
Ooh.
Yeah, so they've had to have it surgically, cut out. So that's can be it. And then you've got all those adhesions going on from there.
My wife's got a friend who's had a surgical band and she hasn't lost any weight.
No, I've known people that do, but the people I've seen that do, I think we talked about, very sarcopenic. So they've lost all their muscle. So they look gaunt and no muscle left. So not a healthy way to do it. But terrible. And even a gastric bypass can also impact you because it does change your microbiome significantly as well. So there can be some disruptions. Here's one that you may not have thought of, or people may not have thought of: traumatic brain injuries.
I didn't think of that until you saw that on the list there.
Really common with SIBO, SIBO, which we'll talk about, small intestinal bacterial overgrowth. We'll have a chat about that.
What sort of brain traumas are they getting?
Well, so even things like a concussion.
Oh.
Yeah, or multiple concussions, things like that, or head injuries, significant head injuries.
Yeah, which is common in sports.
I have seen in the past clients who've been footballers and those types of contact sport athletes have had multiple head injuries, multiple concussions, have digestive issues, SIBOs, things like that. Because there's that bidirectional message that goes from the brain. We know about the gut-brain axis. Yep. So if we're having issues with the brain, then that sort of cuts off that message. And then so anything that's the brain is telling the gut to do, it doesn't do it. So we can end up with, constipation, slow motility, that type of thing. So really common, impacts the automatic nervous system, autonomic.
I didn't think of that. You're right.
Yeah. So,
I mean, another drug that I just thought of then, but is any sort of antidepressant.
Yes.
With the serotonergic ones, stuff the gut up.
Yeah.
Sorry, go back to that.
So that's another one. So, antidepressant drugs. Vagus nerve dysfunction as well. So people have very weak vagal nerve activity.
And that's the nerve that, putting simply, connects the brain and the gut.
Yeah.
Wow.
And here's one that people might not realise: not allowing enough time between meals.
I could be guilty of that.
I think a lot of people are guilty of that. So we have something called the migrating motor complex. So the migrating motor complex, basically, it's it's peristalsis through the GI tract. So basically, it basically pushes its waves, muscular waves that push the chyme through the GI tract. Yeah. But it's not activated till about 3 to 4 hours after you've eaten. So you have to fast, well, it's not really fasting, but have had that break between putting food in your stomach before this migrating motor complex will become activated. So people who eat every 2 to 3 hours, they're not giving that a chance. And what it does is it sweeps everything through, clears all the bacteria and all that sort of stuff, so it's not sitting in your GI tract. Right. So I don't know if you've ever noticed it, but if you fast, you can actually poop more.
Wow.
I don't know if anyone's noticed that. Like, I haven't eaten, but I might feel great. I've eliminated everything because you've given your body that time to activate that migrating motor complex to sweep everything through.
Okay, very interesting.
So
now, let's take your days back to when you were throwing it a bit under the bus here, a little bit.
Yes.
But when you were body sculpting, and a lot of the bodybuilders and body sculptors, they eat every 2 hours. They just try and, if they're in a bulking phase. Yeah. Is that common in that
Very
industry?
Common. Yeah. I mean, but when I was doing it, way back in the day, it was every 2 to 3 hours you had to eat because, God forbid, you didn't get any protein in your body in that amount of time or you'd burn all your muscle off. We know better now.
I saw an article with Jay Cutler, that guy. He was Mr. Olympia. Yeah. And what he used to eat. Yeah. He'd buy 140 eggs at a time, and he'd buy a side of beef at a time, which is half a cow. And just the amount that they would eat and when they'd eat. And good old, one of the bodybuilders watching used to set his alarm for 1 a.m, get up and eat a large meal and then go back to bed. Yeah. Ronnie Coleman.
Yeah, yeah.
And Ronnie Coleman was the king of the bodybuilders, wasn't he?
You've seen him now, poor Ronnie.
Oh,
He's not doing too well. I mean, he's doing all right, but he's had some multiple back surgeries. Can't walk very well anymore. So, but yeah, so that'd be another common one that they're just not giving their digestive system a rest. They're overloading it.
Yeah.
So that's another one. Parasites is another one that can cause disruption to your digestion. So if you get a parasite, it can all upset everything. So
wow.
So there's some of the things that can impact your digestive function negatively.
So someone's listening in the car and they're wondering what signs and symptoms would they get if they've got some of these. Like, what do you look out for?
All right, I've got lists and lists of them. So we've talked about some. Heartburn, reflux.
Yep.
So heartburn is the pain. Reflux is actually when you've got the food coming back up.
Yeah.
Here's some that you may not think about. Chronic throat clearing. So if you ever hear someone that goes, I've just got to clear my throat, I've got a bit of phlegm in the back of my throat.
Got a frog in the back of your throat.
Yeah, and it's chronic. So that's something that can be from silent reflux. So there's reflux where you have all the symptoms. You go, oh, yeah, I've got the burning up my esophagus into my throat. But this one, you don't get any of the burning. You just maybe get a bit of a dry cough, or you have to clear your throat. Yeah. So that sort of thing. So
everyone says, "Oh, I've just got a frog in my throat." Yeah. And it just crosses legs.
I've got a croaky voice at the moment. Yeah. My voice is a bit croaky. I'm not really sure. So that can be one. Dry cough when you're laying down. So people say, "Oh, I just get a dry cough when I go to bed at night." So you're eating too close to going to bed, and then you're laying down, and you're obviously getting some
That's
sort of
pretty common.
Reflux. Yeah, really common. Sinus pain. That you might not think of. Someone goes, I've got a lot of sinus pain, but there's no infection, there's nothing there. That's the acid. So that comes back to that silent reflux again, not uncommon to have some sinus pain, and nose dripping as well. So post-nasal drip, or runny nose, that can also be from silent reflux as well. So you're still getting that acid is irritating the mucous membranes up in the back of your throat and up into your sinus, but you're not feeling it. So they can be some symptoms of reflux. So if you get a little bit of a hoarse voice, or you can clear your throat, dry cough, so consider that it could be some acid.
Jeez.
Yeah, so that's some of them.
Kind of everyone.
Yeah, and then got the classic, so bloating, obviously, so low stomach acid, you're not breaking down your food.
I used to get when I was on the NSAIDs, I used to get so bad bloating. My stomach, it looked like, I did the classic, I was pregnant. Yeah. It just used to distend from right under the rib cage, and it was very uncomfortable. Yeah. I actually said to the doctor once, can't you stick a needle in there and release the gas?
Like they do with cows?
Yeah, because I wasn't, it was just like I was 20, and it was just such a bad pain.
Yeah, I mean, I see clients that have significant bloating, and it's really painful for them. So
it's just awful.
Yeah, so bloating, excessive gas is another one as well, obviously, because you're fermenting the foods in places that shouldn't be, that type of thing. Constipation obviously can be part of it as well. I have made a little note, check whether you're on medications or particular supplements, because sometimes they can be constipating. Yep. So if your constipations come out of nowhere, if you started taking supplements or medications, look at that. If not, then there's obviously some
the worst medication for constipation, one of them are the opioids.
Yeah.
So any pain meds people are on, that's a real bad one, and it actually gets quite chronic after a while.
It does,
The old wife in the hospital puts people on, well, she doesn't put them on, but she treats them with opioids, a lot. And they get terrible, terrible constipation for like a week or two. Yeah,
that's very common. So that could be one.
Yep.
If you're on medications, if you're not and you're constipated. And let me premise that anything less than one bowel movement a day is considered constipation. No matter what people say, no, I only have it every second or third day, but that's completely normal. Yeah. I'm here to say it's not.
No.
Because you don't want to have the toxins and things recirculating back into your GI tract. So we don't want to have that. So diarrhea is another one. Again, supplements can be a cause. People, I've had clients come to me with significant diarrhea, and they're just taking high doses of magnesium. So they get off the magnesium and then diarrhea stops. So it could be something as simple as that if it's come out of nowhere.
Yeah.
If that's not that, diarrhea can be a significant sign of some digestive imbalances going on. So you want to have a look at that. Stools. Poo, big one. Really, I love talking about poo. We love talking about poo.
We love it.
We're naturopaths. We always talk about poo. Like, people come to me and they're like, poo annoyed. Don't be... I will talk about poo till the cows come home.
We could do a whole seminar on poo, couldn't we?
We could do a whole seminar, yeah. So many... Because it can tell you so much. So, obviously, looser, not diarrhea, but looser stools, or greasy stools. So greasy floating stools or pale stools can indicate some fat malabsorption, so that's coming back to that gallbladder insufficiency. Greasy stools, or even if you look, because you should always check your poo, people. Yeah. You should check your poo. The water. So if the water has like an oil slick on it, that's an indication that you're not absorbing your fats very well. So that could be undigested foods in your stool as well. So not breaking down carbohydrates like fibres and things, breaking down your carbs very well. And also mucus. So we do produce obviously a little bit of mucus to push the stool through the colon. But if you're producing a lot of mucus, that can indicate inflammation, because your body will produce mucus for inflammation. So, and blood. So if you get any blood in your stool, obviously that's one where you go straight to the doctor and get that checked every single time. Don't muck around with that.
And when you're over 50, you get it tested every 2 years anyway.
That's right. Yes. Yeah.
You don't know about that, Nic?
No, I don't know about that. Yet. No, I do not.
You don't? You don't?
No, I don't. But I've done stool analysis, so I already know. I've checked on that. Here's one for nausea and vomiting. So that can be liver, gallbladder. It's quite common for those types of symptoms. Referred pain between the shoulder blades.
Oh yes, the gallbladder pain.
Or the top of the right shoulder blade. Referred pain, gallbladder. I had literally just recently a friend whose mother-in-law went into hospital with severe, she'd been sick for days, nausea, all of that type of thing, severe pain between her shoulder blades, and they all thought she was having a heart attack. I said, it's got to be gallbladder. It was gallbladder. So I
remember as a massage therapist, someone came in for a massage for their back, and I'm pretty good with feeling muscles and all that sort of stuff, and there was nothing there. And she said the pain's there. We couldn't locate it. Yeah. And then I thought, it's got to be the gallbladder. And I told her to go to a doctor and check if the gallbladder, and sure enough, she had a gallbladder.
Yeah, so anyone that's getting referred pain between your shoulder blades.
And a referred pain is a pain that's there, but it's not there.
It's not there. It's not in that area, but it's coming from somewhere else, but that's just where it's showing up. So that can be, I see that quite often actually. Oh, yeah. A sense of fullness, like I said, food sitting in the stomach. That's different to bloating. So burping, obviously. And then these are more sort of the liver type symptoms, but, your yellowing of the eyes and the skin rashes, puffy eyes, black under the eyes, puffy eyes. Itchy skin, yeah. Issues with spicy food. So some people say, no, I just can't eat spicy food. It gives me indigestion. Well, the reason it's giving you indigestion is because there's probably some inflammation, maybe gastritis or that type of thing. So if you do find you eat spicy food and get that indigestion, then you've probably got some sort of inflammation going on there.
Oh, yeah, and even drinking alcohol causes gastritis.
Yeah, well, that does, definitely. And then we can look at particular types of bloating. So if you're bloating after you have particularly starchy foods, that can indicate one thing. So we've got to look at what you're eating and when you're eating and how long after you've eaten are you getting the bloating. Is it within 30 minutes or is it within 2 hours? Because that can also tell us where there might be some issues going on in the small or large intestines. And here's another one for liver that people might not be aware of. Sensitivities to perfumes, like strong perfumes, chemical smells, cigarette smoke. It just sort of gives you a headache, makes you feel a bit sick. You just want to get away from that smell. It can be liver. So I include liver in our digestive organs.
Wow.
Yeah.
Yeah, of course.
Yeah, so when we're talking about digestive organs, which we didn't say, so obviously gallbladder, pancreas, liver, and obviously your stomach, so they're sort of all connected, significantly connected. So there's some of the symptoms.
Amazing, isn't it?
Yeah.
It's like everybody gets them sometimes.
Yeah,
it's like
and a lot of people think that they're normal.
Yeah.
So, generally they're not.
No.
So you want to, if it's ongoing, if it's chronic, if it's just more for a few days, something might have upset you, but for chronically, you need to get that sort of thing looked at because, which we aren't going to talk about here, but ongoing digestive issues can then lead to so many different conditions and diseases and imbalances and things like that. So, and that's where it all starts.
Exactly.
So you want to knock it on the head before you end up with any sort of chronic disease.
Yeah. Absolutely.
Yeah.
So all right. So you've got this screwed up digestion. How does that affect other tissues in the body? Like, can it affect the thyroid or something?
Yeah. So there's some conditions that, there's like I said, a lot of conditions that when you've got poor digestion, it can lead to chronic conditions. Some conditions can then cause. There can be sort of a bit of a chicken and the egg. What caused what? Thyroid is a really common one with gut health, digestive issues. So if you're not digesting well, you need that bile to activate an enzyme that converts your T4 to your T3. So if you're not producing bile, it can impact your thyroid function. Liver, obviously, if your liver's not detoxifying properly, it can cause thyroid issues. So if you've got thyroid issues, generally there'll be gut stuff going on as well. So you want to have a look at the gut. SIBO, we talked about. SIBO, so small intestinal bacterial overgrowth, or SIFO, which is small intestinal fungal overgrowth.
Cool.
Or EMO, It's like how many more weeks I
Wasn't that a little
put out?
emo?
Emos, I know. No, intestinal methanogen overgrowth.
Jeez.
So that's all within the small intestine.
Yeah.
So that's where, and this is really common because people obviously they don't have those digestive organs are not functioning well, so their bile is not being produced overly well. They're not producing their enzymes, so it's going through into the small intestine, and then everything's kind of stopping.
Yeah.
And that's when you have an overgrowth because, like we said, most of your bacteria is actually in your large intestine where it's supposed to be. If it gets up into the small intestine, then you have all sorts of problems,
Yeah.
Constipation, diarrhea, severe bloating, all those types of symptoms of SIBO, and it's a really common condition. And it can be purely because of poor bile flow, poor stomach acid. It can be from the ileocecal valve. I said earlier it goes from the small intestine. So if that ileocecal valve is faulty and then that bacteria is then pushing back up from the large intestine to the small intestine, can cause SIBO and that sort of thing as well. So that's why it's really important to make sure that you're producing your bile really well and your stomach acids and things like that to keep everything flowing. Parasites, obviously, that can cause digestive, as we said, and also digestive issues can cause parasitic infection if we don't have the protective
Stomach acid,
acid and bile, antimicrobial. More inclined to get sort of parasites and things coming in with our foods.
That's amazing. And we've done a big podcast on blood tests. And we talked about ALT and AST and all this sort of stuff and liver things. But those blood tests can be screwed up when you've got digestive disorders as well, can't they?
Yeah. So if someone comes in and they say, I've got all these problems, and obviously we go through all the signs and symptoms and see what we can pick out from there. If we have to do some testing, then we look at the bloods. It can tell us a lot. So we're looking at the liver enzymes and things like that to see if they can tell us things. So we can tell things with your GGT is elevated. So if your AST and ALT are elevated, that can indicate some liver inflammation.
Yep.
ALP and GGT elevated indicate some gallbladder insufficiency. So that I see that quite often. High AST, ALP and ALT altogether can indicate celiac disease. So that can do, not saying always, but can do. Urea. So if you've got urea, and we didn't actually talk about this one, can indicate parasites or H. pylori.
Helicobacter pylori.
Helicobacter
That's the old
pylori.
stomach bug.
Yeah.
Now, it's in about a third or to a half of Australians anyway, but some people it's pathogenic, some people it's just sits there and does nothing.
Yes, but there's new research out to show that anyone that has H. pylori infection, even if it's low levels, they're now saying that it should be eradicated.
Really?
Yes, a lot of new research.
Triple medication.
Yes, there's the triple medication which doesn't work in a lot of people. So, the bounce back effect. So, if it's high, so there's also something that's Helicobacter. I'm really struggling. I haven't had lunch
pylori?
yet. Helicobacter pylori can produce something called virulence factor. So, if you're producing, there's so many types of different virulence factors, and one can be make you more predisposed to stomach cancers and things like that.
Jeez.
So, if you have H. pylori with virulence factor, you definitely need to eradicate it.
Yeah.
But I pretty much treat it in anybody that has it because it does shut down those parietal cells. It sort of bores into the stomach lining, shuts down the parietal cells so you don't produce stomach acid. Really common to see H. pylori infection with autoimmune conditions. Really common. So
I think I've been tested for that.
H. pylori, yeah. So you can actually test. I test that in stool.
Jeez.
So you can test it in the stool. The gold standard was the breath test, but now
hydrogen breath test.
Yeah, but that's not 100% accurate. The most accurate is a biopsy, but no one wants to get a biopsy.
No.
So stool testing can actually be a really quite accurate way to have a look, and I see it quite often in the stool. And it's not that hard to treat. You don't need to do your triple antibiotic therapy. You can do it with some natural herbs and things. It's really good.
God.
So H. pylori. So high urea can indicate H. pylori in some people. Obviously, there's other reasons, so you want to look at the full picture, but that can be an indicator for some people. So, and then microbiome mapping is another. I do a lot of it because I do a lot of gut stuff, but that can show you a lot. So that will show up all your digestive organ functions markers. So it show you elastase, which is your pancreatic function. So if you're producing your digestive enzymes. Steatocrit levels, so as we said, so that's fat in the stool. So if you have high steatocrit levels, it can indicate gallbladder insufficiency. Secretory IgA, so our secretory IgA is housed in that mucus layer of our GI tract. So if that's really low, then that can indicate that we don't have much of that mucus layer, and that can indicate a lot of other things. If it's high, it can indicate food sensitivities and things like that. So that's a really good marker as well. Zonulin we've talked about.
Yep.
So that's that protein that opens up those gap junctions. H. pylori, as I said, and beta-glucuronidase is another one that I look at as well.
So enzyme in the gut, yeah.
Yeah, an enzyme in the gut that can deconjugate your bound-up estrogens.
Yeah,
so
you get more of it absorbed.
Yeah, so if you have someone with quite very high estrogens, they've got gut dysbiosis, it could be due to some...
and we can treat that. We get natural medicine.
Yeah, really easy to treat that. So that's some testing, some ways that we can look at what might be going on with the digestive function through some testing. And here's my little tip for the test to test your acid levels at home.
Yeah, what is it?
I don't think this is scientific.
That's right.
I don't know if there's a lot of research around it, but I found that it can work with some people. It's apple cider vinegar and baking soda test. Have you heard of that?
No, but when you add apple cider vinegar together, acetic acid with baking soda, sodium bicarbonate, you get carbon dioxide with gas release.
Yeah, what happens when you add an acid to an alkaline? It bubbles up.
Bubbles up.
Yeah.
If the alkaline's got a carbonate, which most do.
Yeah, exactly. So apple cider vinegar and baking soda, so you take them and then if within 5 minutes, if you're not burping, because that's all bubbling, so within 5 minutes, if you burp within 5 minutes, generally it means you've got pretty good levels of acid in your gut. If you don't, within 5 minutes and even 10 minutes, any longer than that, you really have no acid. So as I said, it's not scientific, but it can be a really handy tip to try at home.
Why not?
Just to see where you're sitting with your acid levels.
Here's an interesting thing. Remember the aluminium hydroxide antacids, and they're still out there?
Yeah.
They don't burp because there's no carbonates in there. The hydroxide, the OH, which is hydroxide, forms the H with the H to form H2O water. It just goes straight through you. So they had this new type of antacid, which is great, doesn't cause burping, but it's full of aluminium, bad for your brain.
Great. Oh, we can't win,
So,
can you?
yeah, you're screwed. Okay, so I want you to put your cap on here, your naturopathic cap, because we're getting a bit low on time.
We are.
We really want to... People want to fix their digestion. What tips have you got?
All right, I can give you some tips that you can do right now without even having to see a naturopath.
Don't want expense, don't want...
Stress management.
Yes.
The biggest one. Because remember we said at the beginning, if you're stressed, you're not going to producing stomach acids and things like that. So for starters, manage your stress, do some stress management work. And then the next thing you can do is eat in a relaxed environment. So don't eat on the run. Don't rush it down because you've got no time for lunch during the day or when you're stressed or running around. And I know this can be difficult because people are short on time, but if you know that you're going to have a big meal, sit down and you can do something simple like take 3 or 4 deep breaths. Yeah. And that will help to activate that parasympathetic nervous system, rest and digest. Yep. So it helps to produce those acids and enzymes. So
that's easy.
That's easy enough. So sit down, relax, take some deep breaths, chew your food. Like we said, just start chewing your food a bit more. Break it down. So obviously the more you break it down in the mouth, the easier it is for the rest of the process. So you don't want to overburden that digestive process. So chew it really well. So there's some really easy things that anybody can do.
Anybody can do that. Yeah. Everyone should be doing that.
Everyone should do that. And another one, so people that have low stomach acid like this, like I said, or they've got the bloating or the fullness and they want to try something at home and just see if it helps, apple cider vinegar.
Oh, yeah.
Brilliant. I use it all the time. I recommend it all the time in clinic as a precursor to supplements to see if we even need supplements because it's an acid. So you take it as a digestive aid. So take a little bit in a little bit of water, not too much, but a little bit because you don't want to burn your esophagus. About 10 minutes before you eat a meal helps to bring the acid up. So that's another really economical way that you can work on your digestive function. So, and don't drink with your meals, people. Don't drink water with your meals. Drink up to 20 minutes before a meal and then wait an hour or so after your meal before you start drinking again. So that's going to help. So anyone can do those, really. It's super simple, aren't they? So you can sort of implement that today. Even if you don't have really poor digestion, it's a good way to make sure that you're keeping it nice and healthy.
So herbs help with digestion too?
Yeah, we have lots of herbs that can help with digestion. Yeah. So we have particularly things to help with, obviously acid, but bile flow. Like I said, bile, I love bile, it's so important. So we have things called choleretics and cholagogues. So choleretics help to produce the bile. So bile is produced in the liver and then it's stored in the gallbladder. So people might be producing it all right, but then they're not. It's not the gallbladder isn't releasing it, or it's very sludgy.
Yeah.
So we want to get some herbs in there that can help with that. So all your bitter type herbs, so dandelion, andrographis, which we love, Steve.
Yes, we love that, don't we? We had some today.
Yeah. St Mary's thistle's really good. It's also a good liver tropo restorative as well.
Yeah, it's a good one.
Turmeric is really good. Fringe tree, and then one specifically. I mean, a lot of these can do both. I love globe artichoke for bile flow.
Oh, yeah.
It's one of my favourites.
We used to use Taraxacum or dandelion root.
Dandelion root's the other one, so I've got that down here. Gentian is another one.
Good for digestion, yeah.
Peppermint, unless you have GORD or GERD, peppermint, because it actually can relax that lower esophageal sphincter. So if you find you have peppermint and you get a bit of acid, then you're having a few problems with your sphincter. So be careful of that. But anything bitter, and even with diet, so start including bitter foods in your meals.
So those bitter leaves you get
bitter leaves, anything really bitter, because that will stimulate the liver to produce bile and all that sort of stuff.
It does, yeah.
So rocket, radicchio, or your cruciferous vegetables. Ginger's really good, lemon lime, dandelion greens if you can get them. Celery is good for bile as well. Please not celery juices. Like, don't do that. That's a whole other podcast juices, on celery juices and that sort of thing. And then if we need to, we can do digestive enzymes. So we can replace the enzyme that the pancreas probably isn't producing overly well. Short term, so that helps to sort of retrain everything. So that can be really good. So we're working on getting your acids up. We're working on your enzymatic production and your bile production and bile flow. So that all of that can help with that. So that's really good. And then if we've got any damage to the gut lining, so we want to do some repair. So obviously inflammation, that sort of thing can be a factor. So we want to support that. So things like glutamine, aloe vera, turmeric, deglycerized licorice is really good.
Yeah, it's a good one, yeah.
Zinc carnosine is really good as well.
It is good.
Slippery elm's one of my favourites.
Yeah.
Saccharomyces boulardii is really good for increasing your secretory IgA levels, and then bone broths and collagen. Collagen's it's a winner for the gut lining. So it's really good.
It's good for your gut too, and it's good for your body as well, and it's low allergenic. And we're going to do a thing on this. It's an amazing new well, it's not new to us. We've been at it for 10 years.
Forever, yeah. We're one of the first people to bring out.
Yeah, but it's just now become really popular, isn't it?
It's had a resurgence, yeah.
So
that's really good.
I mean, so at the end, I mean, there's lots of things here you can do.
One thing I will say, heel drops. So hiatus hernia. We haven't talked about hiatus hernia. Hiatus hernia is when the stomach comes back up through the through the lowest esophageal sphincter. There's a thing you can do called heel drops.
Go on, what are they?
So heel drops.
You want to demonstrate it?
I'm not going to demonstrate it, no, but I'll explain it. It can work for some people. So first thing in the morning, you get up and you drink a fairly large quantity of water, so maybe half a litre of water at once, warmish water. And then what you do is you get up on your toes and you slam down onto your heels.
So it jars your whole body. Boom.
Jars your whole body. You do that about 10 times. And it actually can help to reset the stomach, pull the stomach back down, because the water is pulling the stomach down, and then obviously you're doing that, the slamming the heels down, and it can work for some people. Some people find it really, really good. So that's something that's really good. And then another thing, body work can also help digestion as well. So one, for people that have adhesions, so that massage, the stomach massage, which a lot of people don't do stomach massage anymore.
I was trained in it, but I never really did.
I don't know why people don't know. I guess because they feel like it's too invasive. I don't know. But that can be very good.
Massage, it's like,
I know. And it's good for motility as well. So if you go up sort of right to left, so you follow the ascending colon across and down. So that can help with motility. And also people with back issues. So if someone has a problem with their back's out, something like that, it's not right with their back, and they've noticed their digestion isn't right since their back's been out, it could be because of your back. So obviously the nerves come out of the spine and they innervate to the small intestine, or the intestines and the gut.
The livers and everything,
So if your back's not right, that can impact it. So get some chiropractic or osteopathic work, that type of thing, some stretching, yoga, back twists and things may be able to help your digestion if it's related to your back. So if you've got back issues, look at that. And then reduce our stress, as I said, so adaptogens and nervines and stress management activities.
And
like that.
That's an amazing resume of what to do.
So, if you are having problems and try the things that we said you can try at home with the relaxation and the breathing and maybe the apple cider vinegar, and chew your food. And if that doesn't work and you are still having issues, it's a good idea to
I think
find
naturopaths
somebody.
do very well with digestion. I think we're
Yeah, they do.
really good at that. That's our area where we shine.
Yeah.
Broken legs, not so much.
No, definitely not broken legs.
No,
Any other wounds? If you have your arm cut off or anything?
don't even bother. Don't even look us up in the yellow pages, which don't exist. Does
They
the yellow
don't
page
exist anymore.
Does it exist?
I don't know. Actually, you know what? Because where I live, it's like a small town. We got a community phone book. Yeah, I know. The other week, it's about this thick.
Sure.
Maybe that thick because there's not many people live there. But yeah, I know. I was like, oh my God, I can't believe they even still have them.
Really?
Yeah.
I remember looking them up in the old days.
I know.
The white pages and the yellow
Yeah,
pages.
the white pages were smaller, weren't they? Remember the yellow pages had to
they
be
were
split
massive.
in two? Or was it the white pages got split
Well, when
in
I
two?
ran my college, we were in the yellow pages. We were spending, I think I budgeted one year $50,000 worth of expense.
Yeah, 'cause
and
it
then it
used-
went to 20, and then it went to 10, and it went to 0.
Yeah.
because nobody used it.
No, well, it used to be the main form of
Yeah,
advertising.
it was.
No,
Do you remember? I'm going to say a statement for you.
I was just
Not
going to say
happy,
not happy
Jan.
Susan. Oh, no, I was going to say. Oh, I was
Well,
going to
that's
say not
when you
happy Susan. That's that. Yes, just sent everything. I was
Susan?
Sorry, I don't know because someone called me Susan the other day.
Did they?
Because they were having a go at me and they said something. Oh, hold up, Susan. Sorry to all the Susans out there.
I thought it was a Karen.
Yeah, I know, but I think the Susan is a similar.
Oh, really?
Thing. I don't know. It just sounded not good anyway.
Okay,
So-
Susan. Well, we're running out of time, Susan.
Susan, Jan, Karen. I'm sorry we've insulted every Susan, Karen, and Jan there is.
Haven't we? But I mean,
anyway,
what an amazing! I mean, it's just so complex. You don't think of it. You just eat something and you forget about it.
yeah.
But if you're going through any of these symptoms, these are really bad.
Yeah, and if you're, like I said at the beginning, if you're having some digestive issues, jump on it now and get it fixed because it can become a chronic condition down the track if you let it go because then it just sort of spirals
Causes
out
all
of
sorts
control.
of terrible stuff.
Yeah, so there's plenty of takeaways you can try at home, and if not, then you can see somebody to get that sorted out before you do end up with things like SIBO.
I love it. I love it when people can take away something that they can start now.
Yeah.
You know, it's great. But I think we've certainly run out of time.
We have run out of time.
We have. Look at that. But thanks, Nick. This has been great.
Yeah, it's
because
been great.
It's you can do it right now.
Yeah, well, that's what we're trying to do, more things that people can take away.
Yeah.
Good takeaways. So, if anyone has any suggestions of things that they want us to talk about, conditions they want us to go into further that they're struggling with, happy for suggestions as well.
We're real naturopaths
hit us
after all.
up. We are real naturopaths, yeah.
I'm registered with 2 associations now.
So am I,
Oh,
yeah.
jeez. All right, well, we better leave it there. But you guys have a great weekend. We'll see you all next week.
Thanks, guys. See you.
See ya.